Hi there, my name is Anna DeLopo. I'm a licensed acupuncturist and I practice in beautiful Laguna Hills in Southern California. Today I'm going to be reading about R, my 8-year-old patient, because I'm pretty proud of his results for 10 treatments so far. I've been treating R for ADD, ADHD, aggressive behavior, neck, tics, pain, twitching, and bedwetting. So today, R's mom told me that this was the best week ever at school. The teacher's assistant doesn't have to sit next to him anymore, and that's a big deal because up until recently, for quite a while now, he's had to have a teacher's assistant sit right next to him in order for him to focus, not be disruptive in school, and not be aggressive toward others. The assistant was always by our side to keep him focused and help micromanage R. R is able to really focus well in class now, and that's a big deal. The neck issue has overall improved by 50%. His hyperactivity is 30% less, and at home, R is so much calmer. R used to hit his sister, his little sister, and that was obviously a very big deal as well. So I just want to share some of the results that we've been having since September 12th, his initial treatment. So I've treated R from September 12th until today, which is November 28th. So on September 19, R's neck tics had improved by 50%. His aggressiveness also decreased. On October 2, the neck pain decreased by 20%. On October 10, I was told that R stopped wearing diapers. Bedwetting was an issue. His bedwetting stopped after the first acupuncture treatment. Since then, he's also started sleeping better. He was more verbal, more able to communicate verbally with people, and he was much more focused in school. On October 31, his mother started telling me that he started having the best week at school ever. And obviously, it's progressed since then because every week now is the best week ever. Um, as of November 15, his neck was overall 50% better. So you can see just in 10 treatments since September 12 and today is November 28, how much great improvement that we've made. They were pretty adamant that they didn't want to medicate their child, and they were trying their best to find any alternative medicine that can really help adjust R's behavior at school and at home. I stated this on my Facebook page, and I'll share this here. During the first visit, I had a very long and firm conversation with R. I told him that hitting his little sister was not cool, hitting anyone else was not cool. I asked him if he thought that hitting his little sister was going to help build her self-esteem and if that she would turn out to be a really awesome adult if he kept hitting her, and he replied no, he didn't think it would be. I also made a 32-day chart for him that he had to complete every day. And on this chart, I required him to say 100 times to 10 or more people how awesome they are. He had to say, "You're awesome." I also required him to tell himself that he's an amazing person, that he's intelligent, that he's patient, and that he is loving every day. He was also to tell his mom, his dad, and his sister that they're super amazing and that he loves them every day. He obviously has been listening to me, and I believe they've been doing their chart, and I hope that they continue to do his chart because we're seeing great results. And in my practice, results are all that matter. Just on a side note, whenever I treat R, I always tell him how awesome he is, how proud of him I am, and we talk about his great progress. Building this kid's self-esteem is extremely important to me, as it is with every one of my patients. You can ask any one of my adult patients, and I have similar conversations. Mine was a lot more firm with him because I just don't think hitting siblings is a cool thing. And also I shared that I give this wonderful little dude a big hug before he leaves. That's part of my payment, is a hug at my practice. Also, I stated on my Facebook page that I myself have studied some kind of martial arts since I was age 7, and I strongly recommended to his parents prior to them bringing their son in that he might want to consider studying a martial art. And unfortunately, before I started seeing him, he had started doing martial arts, and they had gotten adverse results. He started becoming more aggressive. So for now, they're putting aside the martial arts. I think that at 90% or more improvement of the aggressive behavior, they might want to revisit that concept. But he does participate in a lot of physical activities, sports activities. So, and I think that with the right martial arts teacher and under the right style, whether it's a physical, a more aggressive form of martial arts like kung fu or karate or maybe jiu-jitsu, maybe he might want to consider tai chi or qigong or xingyi or bagua, but we'll see if he even has that kind of patience. But for now, that's all I wanted to share. I'm very proud of this young boy. I'm very proud of his results. I think he's going to continue to make excellent progress in his school, in his behavior at home, and his mother also told me that now it seems like his sister is the one who's who's trying to provoke negative behavior from her brother. So that's a different issue, but for now, just hearing that he's sleeping better, he's not urinating anymore at night in his bed, his neck is improving. He's much more focused at school. The assistant is not there micromanaging him. Those are great results. So if you know of anyone um, who has focus issues, who has some aggressive behavior that they would like to help curb, feel free to tell them about my practice if they're in Southern California. I'm right off the Lake Forest exit off the 5. My websites again are moveyourqi.com and committedtobetterme.com. Thank you so much for watching my 38th YouTube video. Take care.